At 70 and beyond, facing surgery isn't just another appointment. It can feel like standing at the foot of a mountain, unsure how steep or rocky the climb will be. You've already been through so much in life, and now your body and mind are being asked to gear up again, whether it's for hip replacement, a heart procedure, or even something that seems routine, like gallbladder surgery. Here's the truth. Aging changes the game. It doesn't just affect how surgery is done. It changes how your body handles everything around it, especially recovery. While doctors will focus on the technical side of things, what often matters just as much, or even more, is what you do before you even get to the hospital. Most people don't realize this, but your own preparation plays a huge role in how well you bounce back after surgery, especially after age 70. The little things you do before the procedure can make a big difference in how smooth or how difficult your recovery is. This isn't meant to scare you. It's meant to empower you, because there are simple steps you can take to lower the chances of complications, like infections, medication side effects, post-op confusion, or dangerous falls. Older adults face some unique challenges when it comes to surgery. Muscles don't heal as quickly. The immune system isn't as fast to respond, and the body doesn't handle stress the way it used to. But here's the good news. You're not powerless. Far from it. With the right mindset and a little planning, you can absolutely improve your odds of a safe, steady recovery. You don't need to be a doctor to make smart choices. You just need a little guidance and the willingness to take small but meaningful action. Think of it like a warm-up before a big event. Just like athletes train before a race, you can prepare your body and mind for surgery. And just like training, the sooner you start, the better your results. It's not just what happens during surgery that counts. It's what you do before and after that helps you avoid setbacks and get back to the life you enjoy. So whether you're reading this for yourself or for someone you care about, know this. Surgery after 70 doesn't mean the end of the road. It's just a bend in the path. With the right tools and a little knowledge, you can round that corner with strength and confidence. In the next part, we'll walk you through 5 essential steps every older adult should know before heading into surgery. Practical, science-backed advice that can help you heal better and feel stronger afterward. Because at this point in life, it's not just about adding more years. It's about adding more life to those years. And we're here to help make sure surgery doesn't get in the way of that. And this is just the beginning. The more intentionally you prepare, the more smoothly your recovery can go. Every small choice you make, what you eat, how you move, how well you rest, and even your mindset can have a big impact on how you heal. If you found this helpful, don't forget to subscribe to the channel for more easy-to-understand health tips, made especially for folks navigating life after 70. And be sure to hit the bell icon so you never miss an update. Your future self will be glad you did. Bell. Now let's talk about the first thing every senior should focus on before any surgery. Before you even step into the operating room, there's something most people overlook, but it can shape your entire recovery, your physical condition before surgery. Many older adults think that once the procedure is scheduled, their job is done. But your body doesn't press pause while you wait. In fact, what you do in the days or weeks leading up to surgery can matter just as much as what happens on the day itself. This is known as prehabilitation, and it's a powerful way to prepare yourself. You don't need to become a gym regular or start lifting heavy weights. Prehabilitation is about gently strengthening your body to make it more resilient and ready to bounce back. A body that's been moving and stretching, even just a little, tends to heal faster than one that's been sitting still. Simple movement makes a huge difference. Light walking, easy stretching, breathing exercises. These small efforts can help your muscles, your lungs, your heart, and your mind prepare for what's ahead. And don't underestimate how much that preparation matters. Why? Because movement helps your lungs and blood circulation, which lowers your risk of complications like pneumonia, blood clots, or even post-op confusion. Many seniors wake up feeling groggy or disoriented after anesthesia, not just from the drugs, but because their bodies weren't ready to handle the stress. Getting your body stronger now means your system can clear out the medication faster and start healing sooner. And then there's the emotional side of it. Moving your body, even a little each day, gives you back a sense of control. Surgery can feel scary, especially when there's uncertainty involved. But when you walk a few more steps than yesterday, or stretch for 10 minutes. You're sending a powerful message to yourself. I'm doing my part. I'm not helpless. I'm ready. That simple mindset shift can reduce anxiety, improve sleep, and even speed up your recovery. You don't need to overhaul your entire routine. Just start small. Maybe take a longer route around the house. Try some gentle chair exercises. Or find a senior-friendly video online to follow along with. If you're not sure where to begin, ask your doctor or physical therapist. They'll help you build a plan that's safe and tailored just for you. The bottom line? The stronger and more active you are before surgery, the better your chances of bouncing back quickly and avoiding setbacks. Yes, your body might take a bit longer to respond than it used to, but that doesn't mean it won't respond. It will, especially if you give it the support it needs. Every little step you take today is an investment in how smoothly your tomorrow goes. So start now. Give yourself every possible advantage, because you deserve a recovery that's not just safe, but strong, steady, and full of life. The second, one of the most overlooked, but absolutely vital steps you need to take before surgery, especially after age 70, is reviewing your medications. It might not sound dramatic, but this simple step can literally make the difference between a smooth recovery and serious complications. At this stage in life, most people are taking several medications. Some prescribed years ago, some recently added, and others over-the-counter or even natural supplements. They can seem harmless, especially if you've been using them for a long time. But when surgery is coming up, the way these medicines interact with your body and with each other can suddenly become risky. Here's what most people don't know. Certain medications can increase your chance of bleeding during surgery, slow your healing afterward, interfere with anesthesia, or even lead to something called post-op delirium, where you wake up confused, forgetful, or even hallucinating. It's more common than you might think, especially in older adults. Take blood thinners, for example. Aspirin, warfarin, or even newer ones like Eliquis. These drugs help prevent strokes and heart attacks, but if not carefully adjusted before surgery, they can cause serious bleeding. But here's the tricky part. Stopping them too early can also be dangerous. It's a delicate balance, and your medical team needs to know exactly what you're taking to make safe decisions. And it's not just prescriptions. Supplements like fish oil, turmeric, vitamin E, ginseng, even ones labeled natural, can thin your blood or interfere with medications used during surgery. Just because something is natural doesn't always mean it's safe for surgery. That's why a complete medication review, also called a meds check, should be a top priority. Don't wait until the hospital asks for a list the night before. Talk to your primary care doctor or pharmacist ahead of time. Bring everything, every pill, bottle, vitamin, herbal remedy, skin patch, eye drop, anything you use regularly. Nothing is too small to mention. And while you're at it, ask an important question. Do I still need this? Over time, some medications might not be necessary anymore, or they may not be the safest option before surgery, especially medications that affect your brain, like sleep aids, sedatives, or certain antidepressants. These can increase the risk of waking up feeling foggy or agitated after surgery. That can be upsetting not only for you, but for your family, too. Thankfully, many of these meds can be adjusted or paused temporarily with your doctor's help. Managing your medications wisely isn't about being picky. It's about protecting yourself. You're giving your surgical team the tools they need to keep you safe, and you're giving yourself a better shot at a quicker, clearer recovery. One thoughtful conversation with your doctor can lead to fewer complications, less confusion, and possibly even a shorter hospital stay. At this age, that's not just important, it's life-changing. The third. Now let's talk about something that's easy to overlook but incredibly important before surgery. What you eat. Nutrition plays a bigger role than most people realize, especially for older adults. At 70 and beyond, your body doesn't bounce back quite the way it used to. It needs the right fuel to fight off infection, heal wounds, and keep your strength up during recovery. And that fuel comes from what's on your plate. Here's something many people don't realize. A lot of older adults are slightly malnourished without knowing it. It has nothing to do with being underweight. You could look completely healthy or even carry a little extra weight and still be lacking the nutrients your body needs to heal. Why does this happen? As we age, our appetite can decrease. Medications, dental issues, or even just the effort of cooking can lead to skipped meals or less nutritious choices. But surgery demands more from your body. And if you're undernourished going in, you'll have a harder time bouncing back. Protein is one of the most important nutrients to focus on right now. Your muscles, skin, and immune system rely on it to repair damage and recover strength. After surgery, your body goes into overdrive trying to heal, and it breaks down tissue quickly to do so. If you're not getting enough protein, that healing process slows down. That means longer hospital stays, higher risk of infection, and greater chance of muscle loss or weakness. But it's not just protein. Your body also needs things like vitamin D, iron, calcium, and healthy fats to fight off infection, maintain energy, and rebuild tissue. And don't forget hydration. Water plays a critical role in keeping your circulation healthy and your mind clear. Even mild dehydration after surgery can lead to confusion or fatigue. So what can you do? Start at least 2 to 4 weeks before surgery if you can. Focus on eating balanced meals with plenty of protein-rich foods: eggs, chicken, fish, beans, lentils, Greek yogurt, tofu, or protein shakes, colorful vegetables, and fruits. These are loaded with antioxidants that support healing, whole grains, and fiber. They keep your digestion regular, especially since pain meds and anesthesia can cause constipation. Hydrating fluids. Aim for water, herbal teas, or clear broths throughout the day. And if you have any dietary concerns like diabetes, kidney problems, or food allergies, talk to your doctor or a dietitian. They can help tailor a plan that supports your body without putting you at risk. Don't forget about your gut health either. Surgery, antibiotics, and painkillers can throw your digestion out of balance. Consider adding foods with natural probiotics like yogurt, kefir, or fermented veggies to keep your gut running smoothly. Here's the good news. You don't need to be perfect. You just need to make progress. Even 2 weeks of better nutrition can help your body walk into surgery stronger and walk out of recovery faster. Think of it like fueling up your car before a long drive. The better the fuel, the better the performance, and the fewer problems along the way. You're not just eating to survive. You're eating to heal, to strengthen, and to support the version of yourself that's waiting on the other side of surgery. The one who wants to feel strong again, walk a little taller, and get back to life. If this advice is helping you feel more prepared, consider subscribing to the channel for more easy-to-understand health tips made just for adults over 70. Tap the bell icon so you won't miss the next part of this important guide. Next, we'll dive into the 4th thing you need to know before surgery, something that doesn't involve your body, but has everything to do with your mindset. The 4th, when surgery is on the horizon, especially after age 70, it's natural to focus on your physical health, your heart, your lungs, your diet, your medications. But there's something just as important that often gets overlooked: your mind. And yet, your emotional and mental state can have a powerful impact on how well you recover. Stress, worry, fear, even loneliness. These quiet feelings can work against you in ways you might not realize. They can weaken your immune system, disrupt your sleep, increase inflammation, and even make pain feel worse after surgery. That's why preparing your mind is just as essential as preparing your body. Let's be honest, surgery at this stage of life feels different. You're older, wiser, but also carrying more life experience, more memories, and maybe even more fears. Will I wake up okay? Will I still feel like myself? What if things don't go as planned? These are honest questions. Pretending not to be anxious doesn't make the fear go away. It only buries it deeper. In fact, research shows that people who go into surgery with high levels of stress or fear tend to have longer hospital stays, more complications, and slower healing. So instead of hiding your emotions, try facing them head-on. Talk to someone. It might be a family member, a close friend, your doctor, or even a counselor. Just speaking the worry out loud can take away some of its power. And knowledge helps, too. Ask your surgeon or anesthesiologist to walk you through what to expect. The more you understand about the process, the less room your mind has to imagine worst-case scenarios. Replacing uncertainty with clarity helps lower fear, and that's a big step towards smoother healing. You can also give your mind the comfort it needs with simple relaxation practices. You don't need to learn complicated techniques or spend hours meditating. Even 10 to 15 minutes a day of deep breathing, calming music, or quiet mindfulness can lower your blood pressure, ease your nerves, and improve your sleep. Try guided imagery. Close your eyes and picture yourself healing, walking again, laughing, doing something you love. Your brain can't always tell the difference between what's imagined and what's real. And that powerful image of healing can help your body move toward it. Another way to ease anxiety? Create a plan for support after surgery. Who will drive you to follow-up appointments? Who will help with groceries, meals, or house chores? Knowing you're not alone can calm your mind more than you think. Even if you're usually independent, this is the time to welcome a little help. Not because you're weak, but because you're wise. And finally, hold onto something we often forget: hope. You've been through tough things before. You've made it through challenges that once seemed impossible. This is just another one of those moments. A positive, realistic outlook that says, I know this won't be easy, but I believe I'll get through it, can actually improve your body's ability to heal. Caring for your mental and emotional well-being isn't extra. It's part of the plan, just like nutrition or exercise. Your mindset is a tool that can speed up recovery or slow it down. Choosing to prepare your mind is one more way you take control of this journey. Because while surgery may happen to you, recovery happens with you, and the strength you bring to it matters. The fifth, the final and maybe most empowering thing to remember as you prepare for surgery after 70 is this: you have a voice. Use it. Too many older adults walk into surgery feeling like passengers on a train, just trusting the doctors to drive and hoping everything goes smoothly. And while trusting your medical team is important, being involved in your own care is just as essential. When you speak up, ask questions, and take an active role, you're not being difficult. You're being smart and safe. This starts with asking the right questions. Not just when's my surgery, but what are the risks for some of my age? How can I reduce the chance of infection? What should I expect the first few days afterward? How will pain be managed? And what should I watch out for? These aren't silly questions. They're responsible ones. And asking them helps your care team give you the best possible support. Another thing many people miss? You should know your discharge plan before the surgery even happens. What medications will you be sent home with? Will you need physical therapy? How soon should you be up and walking, or eating or showering? These are not details to rush through when you're groggy and ready to go home. Go over this plan with your doctor or nurse ahead of time, and if possible, have a loved one with you to help listen and ask questions. It's also a good idea to get your paperwork in order. That means having a clear list of your current medications, any allergies, medical conditions, past surgeries, advance directives, or a medical power of attorney. Having this ready ensures your wishes are known and respected, especially if you can't speak for yourself during or after surgery. In a moment of stress, this preparation can make everything safer and simpler for you and your doctors. And don't go through it alone. Bring someone with you to pre-op appointments or to help during recovery at home. A second pair of ears can help catch important details you might miss. If you live alone, make a plan. Line up someone who can call or stop by regularly. It's not a sign of weakness. It's a sign of wisdom. Being your own advocate doesn't mean challenging your doctors. It means working with them. It means knowing enough to ask the right questions, being clear about your needs, and making sure your voice is heard. Because here's the truth. This is your body, your recovery, your future. You've lived a full life. You know what matters to you. So take that experience and use it. Ask, plan, prepare, and speak up. That clarity could mean fewer complications, a faster recovery, and less frustration along the way. Surgery after 70 isn't something to fear. It's something to meet with confidence, wisdom, and readiness. And when you bring all the pieces together, your physical strength, your medication awareness, your nutrition, your emotional balance, and your own powerful voice, you're not just preparing for surgery. You're preparing for a stronger, smoother recovery and a return to the life you love. You deserve that. And your body and your future self will thank you. Preparing for surgery after 70 isn't just about arriving at the hospital on time. It's about showing up for yourself, long before the first incision is ever made. Because recovery doesn't start on the operating table. It starts in the days and weeks leading up to it, with the quiet, intentional choices you make each day. Now, I know what those choices are. By gently moving your body, reviewing your medications with care, nourishing yourself with the right foods, calming your mind, and speaking up for your needs. You're not just waiting for surgery to happen. You're stepping into it with strength, clarity, and purpose. These 5 simple steps may not seem dramatic, but together, they create a solid foundation for healing. A foundation that leads to fewer complications, less stress, and a smoother, more confident return to the life you love. Because no matter your age, you still have power, you still have a voice, and you absolutely have the right to ask for and expect a safe, thoughtful, and respectful healing journey. Yes, recovery may be challenging, but with the right preparation, it can also be full of progress, peace, and strength you didn't even know you had. So take this knowledge seriously. Share it with someone you love if they're facing surgery too. Most of all, believe in your ability to heal, not just as a patient, but as a whole capable person. You've come this far with courage. Let's make sure you keep going, stronger, wiser, and more prepared than ever. If this video helped you and you want more simple, practical tips for living well after 70, go ahead and subscribe to the channel. We're here to walk with you through surgery, through recovery, and through all the years still ahead. And don't forget to tap the bell icon so you never miss a helpful update. Thank you for watching, and take good care of yourself. You've earned it.